Hey everybody, this is a terrific episode. We are going to be talking a lot more broadly about non-neurotypical children, and we got a bit distracted with ADHD. We just had so much to talk about, such an incredible conversation. I asked them if they could extend it, do an extra long episode. Really like to get them back again, so leave any comments, any questions that you might have, anything like that. We didn't get to half the stuff I wanted to cover. Put it out there on social media, Facebook and Instagram and all that stuff. Was asking for questions. Hey, who wants to know about non-neurotypical children, autism and ADHD, things like that? And I was overwhelmed with the response that I got. People had so many questions. Obviously, this is a topic that I need to cover a whole bunch more than I have in the past. Me without children didn't realize how much folks care about this topic. Such a terrific conversation. And today's episode is brought to you by Jeffrey Oliver. Patreon Saint Jeffrey Oliver has been a long-time supporter of the show. We got to have an hour-long Zoom chat, and I got to thank him. We got to have a great chat about life and get to know one another a little bit. If you want to be a Patreon Saint, support the show, sponsor an episode, chat with me on Zoom, head over to Patreon. It seemed crazy to me at first. Do I really want to talk with strangers on Zoom and potentially even put those chats on Patreon for other people to see? Fortunately, the people that are into a science podcast are really awesome, interesting, curious people who it's so nice to meet like-minded people. It's so hard to have big conversations like this, and that's why I've started a Discord community recently, which you also have access to through your Patreon support. All right, enough with the plugs. I hope you enjoy today's episode. Here we are. Look, we're having fun already. Welcome to the Here We Are podcast, everybody. I'm comedian Shane Mauss. Joining me today is Claire Duckwitz and Natalie Mannherz. Why don't you guys introduce yourselves a little bit? Because you guys also have a science podcast of your own, correct?
Yes, that is correct. So I'll introduce myself, Claire, first, and then you can go. So I'm Natalie, and I am a pediatric occupational therapist, and I've had my own practice for about 11 years, and I work with children mostly who have sensory processing disorders and autism spectrum disorder and developmental delay. And Claire and I know each other because we have mutual clients, and we've worked together in Boulder, Colorado, where I no longer am, but that's where we met.
My turn?
Yes,
okay.
Claire.
I'm Claire Thomas-Duckwitz. I'm a licensed psychologist and a licensed school psychologist. So I have a master's in clinical psychology and a PhD in school psychology. And I work in a private practice. I sometimes teach at a university, and I work part-time in a school district. And I guess most of my population that I work with is, are kids on the spectrum or kids and adults with ADHD.
Yeah, so
Fun.
we have a podcast that we are doing, which is super fun.
What's the name of it?
It is called A Little Cerebral. And it is about, I'll tell you who it's for. It's mostly for for parents who have children with special needs or children with different needs. And the goal as to why we made it is because we wanted to have more of a community for parents who have children with different needs, and just another place for them to gather and share stories. So we have parents share their stories that we then share, so that it creates a community through that, and people can, kind of find value in that and commonalities. And then also we share just different terminology and diagnosis and information that's kind of thrown around a lot in the special needs world, that a lot of parents, you get the diagnosis and then it's you have all this information kind of coming at you. So part of it also is just to educate from a non-biased point of view as well for parents.
Yeah. I have nothing to add.
So
That's great.
Why, thank you. I'll be here all evening.
I'm gonna start saying that, by the way. I put a lot of pressure on myself to add things for no reason. A lot of times I'm just adding something just to be adding something. I'm going to start saying I have nothing to add. That was great. If there's one takeaway from this episode, that should really be the title of my podcast.
I have nothing to add. Period.
This is I have nothing. So where are we with how we how do we talk about kids that are, because I asked, first off, I know people are going to be very, very interested in this episode because since I've been doing these remotely, I've for the first time started posting things on social media and Patreon, different things, asking people, hey, we're going to be talking about ADHD and autism and school reopening and education and people were so excited to hear about this. And I saw a lot of different language being used in terms of, I was very familiar with like special needs when I was kind of when I was in school. That was what was being used. And then there was like, what's the new one that I'm seeing a lot more of? Non-ordinary or something like that.
So are you talking about like not neurotypical?
Yes, that's the one. Way better than non-ordinary.
Not ordinary.
Non-ordinary. Well, see, this is why it's important to have this conversation, because there's a lot of well-meaning dopes like me out there that don't know exactly how to talk about it.
Yeah, I think the term can also be like neurodiverse. You talk about a neurodiverse population, like neurodiversity. But I also think it depends on the individual. I mean, I say children with different needs because I think when people hear the term special needs, and actually, Claire, I'd be curious to hear your point of view on this. When I think people hear the term special needs, what comes up for them, just for the general population, it tends to be more like physical disabilities or really kind of significant disabilities in terms of even like children who have an autism diagnosis and then they're nonverbal. So there's a lot of things in between, including like invisible disabilities or just developmental delays. So it's not necessarily like special needs encompasses like everybody, just like autism encompasses like a huge like a range of presentations. But
right.
I think that when people hear special needs, they're like, oh, they must have like, an adaptive equipment like a wheelchair, or they must have like all of these services, or they must be nonverbal. So I say different needs because just depending, there's like special needs, it's just like such a huge thing. And, kids come in, I mean, obviously all shapes and sizes, but in terms of just their development too, you could have a child who really doesn't even qualify for school services, who's really struggling. And so they have a different need or they struggle with regulation. And that's not even necessarily like a diagnosis. They're just like dysregulated.
Yeah, there's a lot of stuff that doesn't fit neatly into a diagnosis. I mean, so for me, I'm in two different worlds, right? So in the school system and in special education, disability is the terminology that's used. And then if you're in a clinical setting, like as a psychologist using a DSM, DSM-5, you would use the word disorder. I like the word disability. That's typically what I use.
DSM, we into it? We for it? We against it? What are you thinking?
I think that's a complex question. I mean, I would say I'm mostly into it. I'm disappointed that developmental trauma or complex trauma wasn't included in the most recent version of the DSM. I think there was a lot of evidence to support developmental trauma as very different from sort of like PTSD. And so I think that the outcomes are very different. And I think that should have been in there. So I disagree with that.
I'm also, can I express my disappointment as well? I'm disappointed that sensory processing disorder was not included in it.
That was my next one.
Because that's huge. 1 in 20 children are diagnosed with sensory processing disorder. Like, why is that not in our manual?
I'm disappointed. I don't know sensory processing disorder. What is you just
it is
like
quite disappointing.
That really is. You just like hear taste or something like that? Is this just like,
I mean, that would be way cool.
When I do LSD and I have sensory processing disorder, is it?
Yeah,
I mean,
like same, but probably more different than that. It's sensory processing disorder is basically like, so you have all these senses that come in, and your brain has to process it from the lower brainstem up to your like upper brainstem. And so depending on how effective or efficient your brain is at processing them, you can present different ways. So everybody always has like strengths and weaknesses in terms of how they process like everything that's coming in. So that could be like from sight, from hearing, from taste, from touch, from everything. And it's a way that you make sense of your world. So for example, one that's kind of thrown around is really auditory processing. And that's very specific to that sense of hearing, right? So I could have like, if I'm listening to something, I might not be able to pick up words. Like I talk pretty fast. So for someone who has auditory processing, they probably would have like very little idea of what I was saying right now. But more than that,
some processing.
yeah. So yeah, right. But more than that, it's more about just when you have, it's not specific to one sense. So I think that's kind of a common misconception. It's really about, what level of the brain has a processing disorder and problem processing information. And then when you have problems, let's say discriminating with touch, you're going to have problems most likely with like regulation. So it kind of impacts like a few different levels typically in the brain, but it's just how you make sense of your world, and your brain sort of gets like the pathways are a little bit off or just like not as effective. It could be slow.
Seems like an important issue.
Very.
Well, it sounds like you guys do have mad beef with the DSM, if I can put words in your mouth. I
Major beef.
Yeah, I understand. Now, let me throw this at you. I would say that there's a lot of people out there. I would maybe even include myself on this list in some regards. But there's certainly, it tends to be, you'll hear from older folks like, well, where did all these things come from all of a sudden? They're just making up stuff. And it does seem, the DSM does seem to get larger and larger all of the time, which to me, I think that's exciting that we're kind of evolving as a culture and a species and in science and our understanding. And this is just much in the way, this is much like mindfulness, or we're just becoming aware of more things, and also being able to tease apart different things that maybe we lumped into one category before. But it's also, do they ever take anything off the DSM? Do they ever be like, nah, never mind, we screwed up on that one.
Yeah.
Turns out the kid was fine.
Well, and so in the DSM is, so I should say it's for everyone, right? Like, so it's not just for kids. It's just that I work within the realm of kids, and it's so broad that I mean, I can't. There's a lot of disorders that I can't speak to because it's not really something I work with. So I typically work with the neurodevelopmental disorders, and then anxiety disorders and some trauma. That being said, so to answer your question about things being taken out, being, so now we use the term queer, right, or gay or lesbian, and so homosexual, because it was put in the DSM, is actually considered an offensive term to a lot of people because it was considered a mental disorder, and that's no longer in there. So yay.
Oh, I forgot about that one. Yikes.
Yeah, no kidding. I think there's also, and Claire, I think you should speak to this, is that there's a lot of also like nuances. Yeah. Like we were talking the other day about like oppositional defiant disorder and kind of ADHD and all the subcategories of ADHD. So you always start with like one major thing, like, oh, this is ADHD. And then you're able to define it into all these different like subtypes, which I think is even more interesting.
Yeah, I mean, and the DSM doesn't we talked a little bit about, we tried, there was a bird that got in the way.
Yeah, we both have ADHD, and there was a bird, like this really loud bird. And so our whole episode, Claire started it off. She was like,
it was the
I
bird
wanted to talk about, yeah.
You guys both have ADHD?
Mine's not diagnosed, but yes. And let me just say that ADHD is strong in my family. And
Well,
and I definitely, I would say yes, I have combined.
This is like this is interesting to bring up because this is another grievance that you hear aired, especially amongst the general public, that I also empathize with. I kind of relate to this position that this kind of self-diagnosis that we do on ourselves, how accurate is some of this stuff. Now, I'll say this as someone who is also hasn't been officially diagnosed with ADHD, but I've just known it. I'm like, why would I take a test to know, I know what I have. I'm like, I don't really have interest in like taking a medication or whatever. And then I had oh shoot, how am I forgetting her name all of a sudden? I'll put it in afterwards. I had a fantastic ADHD researcher on a couple of years ago. Oh shoot, what was her name? It'll come to me. And I took a ADHD test. That she, I imagine an official test might be a bit more involved.
Yeah, it's a number of tests when you do an evaluation.
I just did a fun ADHD questionnaire for the podcast, and I flying colors, 100%. Every single question on the questionnaire was the most extreme ADHD answer that a person could have. So what are your thoughts on this in terms of in a world where everyone's on WebMD? What issues do you see with this of some of the overdiagnosis that happens?
Well, I have a lot to say about this. So
sure.
And I'm going to try to remember all the things I want to say, because that's hard for me sometimes. So the first thing I would say is yes, people do self-diagnose. I diagnose people for a living, so I feel like okay with that. And since I have family members with it, I feel like extra okay with it. What I would say is, so ADHD is rule in and rule out. And so there's a lot of symptoms with ADHD that look like, or there's a lot of other symptoms with other disorders that look like ADHD, right? So you rule in the symptoms, which actually often isn't that hard. A lot of people can they will endorse the fact that they have those symptoms. That being said, that's why a careful clinical interview is so important. Because, so for me, one of the big ones is trauma. So there's a lot of people who have like a history, especially if it's a history of complex trauma where it started in childhood. So then some of these symptoms are appearing in childhood because, ADHD is a neurodevelopmental disability, so it has to have started in childhood. But there's a lot of symptoms of trauma that mimic ADHD. And so sometimes differentiating that is really hard. And I think that a good clinical interview can be helpful, and just really asking questions about what that, when they're talking about a particular symptom, tell me more about that, explain what that's like. So you can really get a sense of, does this seem like ADHD or does this seem like something else?
Oh, can I go? So I actually do have a formal diagnosis of ADHD, but this was given way back in, way back when there were different subtypes, and it was, I just did it more at an age where I wanted just the gratification of having other people almost recognize that this is why I am the way I am. That being said, kind of similar to Claire, I think that, seeing a lot of children with ADHD, it's easy to kind of trace back, those symptoms. Now, I think a big part of it is really being able to analyze whether you're a parent or an adult or anything in between, how much of it is really impacting your life. So in terms of function versus dysfunction.
That's
yeah. And I think that's a really, really big thing. A lot of people are walking around with ADHD symptoms, but are they able to manage? Is it taxing emotionally? Is it, making their job harder? All of these things kind of come into play. And then I also think there's a lot of other things that go into specifically symptoms of ADHD, including, how well your quality of sleep, and also going along with that, even just if you are mouth breathing too, that can impact like also it goes into, they're all related, right? Everything's always related. It's never just
wait.
one thing.
Wait. I'm sorry. Could you go back there? What did you just say? What was the thing about mouth breathing?
So if you breathe through your mouth, which can be related to more like tethered oral tissues or, just like for structural reasons, let's say. So you don't have your tongue rest on your palate. And this is like a whole different discussion. Mm-hmm. But when you are sleeping, then what happens is that you breathe through your mouth and then your body sends a shot of adrenaline every like 20 to 30 seconds to wake yourself up. So you essentially can breathe through your mouth. And then from that, you're unable to get into a deep sleep. So then you have these kids and adults who are chronically tired. And then the way that it presents when you're chronically tired to wake yourself up is you look like kind of like this tornado. You have presentation like ADHD. It's really hard to concentrate on one thing and you're kind of like running around. So I think a lot of people are just chronically tired too.
Can I?
Is that my thing? If I just found out that's what I've had in my whole life, I'm going to be upset with myself for not getting an actual. Maybe I should have been like, whatever, I got the thing. Maybe
you could get a sleep test and see, your quality of sleep.
Can I say something?
No, Claire, you can't say anything. I'm talking to Natalie here. All right, Claire, what do you have to say?
What I wanted to say is, ADHD is more than just like, I think we think of, hyperactive kids who are running around, right? Or like inattention, distractibility, but it is more than that. There's something called goal-directed persistence, so staying focused on tough tasks. Typically with ADHD, you would also see executive functioning impairment, which that's another rabbit hole.
And emotional dysregulation as well.
Yes, and I actually think that there's a lot of people. So in addition to the fact that there's people who are diagnosed with ADHD who do not have ADHD, there are people who are not diagnosed with ADHD and they're diagnosed with something else and they have ADHD. And I think the emotional dysregulation really throws a lot of people off because I think like especially if it's not somebody who, is in the field, like sometimes people will make comments like, oh, it must be bipolar, right? Because their mood is all over the place. But emotional dysregulation is definitely, a big part of ADHD. And so I think that that's often missed and it's mistaken for other things.
And emotional dysregulation really can be like having emotional outbursts. Like I cannot regulate my emotions. So it goes along with that impulsivity, right, Claire?
Yes, but it's also, so there's like emotional clarity. It's like, how am I doing right now? And then there's that ability, so there's these other like underlying kind of building block skills that would be kind of like more like executive functioning type skills. So like inhibiting, so stopping yourself from doing something that you want to do. And if that's the impulsivity, right? And so if that's impacted, then that would affect the emotional outbursts, right? Like you are having a hard time keeping yourself from having this outburst, and maybe you're not aware of how you're feeling at this moment. And so there's other things that go with it too, but and you could even think of like metacognition, right? Like your ability to know, like, how am I doing? Like sort of just compared to other people. There's just a bunch of things that go into the emotional dysregulation. I feel like a bunch of building block pieces.
I do think though that, and Claire and I talk about this quite a bit, is, whenever you have a symptom or a behavior or an issue that is impacting your life in a more dysfunctional way, you have to look at the most foundational level and build up from there. So, for example, like ADHD is a very complex, as Claire just laid out, a very complex diagnosis, and there's a lot of different pieces to it. So, going from there, figuring out what's the most foundational level. So that's why, for me, when I see clients, a lot of times I'm looking at sleep and their quality of sleep, because that's going to impact just their behavior during the day and how they feel. Same thing with nutrition. And also that's going to impact how they feel. A lot of children that, we work with who have processing disorders also have trouble processing food into their gut. So that can, lead to chronic inflammation and some other things. We refer out for nutritionists, but just looking at, the very foundational stuff like sleep, eating, Claire, what else is foundational?
Well, I mean, some of like the nutrition, like we were talking about, like so omega-3s can be really helpful. They don't have a very strong effect size, but they can be helpful. They've been shown consistently to be helpful.
With ADHD.
With ADHD.
Yeah.
Actually, I think with other disorders, behavioral regulation too. But yeah, certainly with ADHD. Mm-hmm.
Yeah, but I think that just
like stimulants really are like, I'm not saying that you should go straight to a stimulant because we talk about doing these building block things first. But, once you've done all of that, stimulants, really do have good data behind them. So, but sorry, I interrupted you, Natalie.
Yes, I thought of my third one though.
Right.
It's sleep, nutrition, and then also just making sure that you have the ability to process as you should be able to. So, for example, if I always send or recommend like a chiropractic care for kids as well, just because depending on how they're born, et cetera, like any physical trauma can impact, especially the level of the atlas. And I think that can like overstimulate or understimulate, just to very much generalize it, either the parasympathetic nervous system or the sympathetic. And then that can kind of tend that child to more of like one extreme or another. So just making sure that everything that our body and our brain relies on is like set foundationally and then going up from there.
Yeah. And
wow.
And then I would do more of like the top down type stuff. So more of like the cognitive behavioral strategies. And I guess I should, I need to back up because with the stimulants, as I'm thinking about this, like the effect sizes are for symptom reduction, but you were talking about functional impairment, right? And so like cognitive behavioral therapy, I mean, especially if you're teaching particular strategies that are addressing like executive dysfunction, and I would actually say things that help with emotional regulation, like DBT, dialectical behavior therapy, those can be really helpful from a functional point of view. So I feel like it's like this holistic approach. And we're not even talking about like neurofeedback, which is also great, right? So,
right. So I wouldn't, right. I think that if you're wondering, gosh, like, does this apply to my child? Does this apply to me? I think that the best thing you can do first is, I think you can start to educate yourself just like around whatever you think it is. And then I think that looking at those foundational levels is really important. And then, seeing the correct professional as well from there. But you can always address nutrition. You can always like kind of think of what your sleep habits are just to even see if that's an issue. Yeah.
Wow. So, let me go.
Is your mind blown?
Well, it's all over the place because I'm ADHD. Let me go on a long-winded monologue about myself, sharing information I'm sure my listeners have heard 100 times before, and I'm gonna say it anyway. I really like thinking about these subjects because I mean this is going to be a little indulgent, a little bit of me search here, but I have. So one, I have terrible impulse control issues. Anyone that knows me would verify that. I like to think of myself as a pretty emotionally well regulated, even keel person, unless you follow me on Twitter. And then you would probably disagree. There's a couple things.
Impulsivity. That might be what that is. Sorry, interrupted. Pardon me.
Yeah, I need to, as soon as I'm done typing it, I just need to hit send. I don't proofread or anything. And then afterwards I look at it, I'm like, oh no, why did I, can't delete now. It's already there. But I had, I'm hung up on two things. One, I'm going to push back against some of the, like, I'm curious how we qualify, like, what is functioning human. And then I'm still stuck on the sleep thing. This blows my mind because one, I think I'm like an open mouth, like I'm a real like drooly fella. Like this beard's just not working right now. I just wake up. And then I found out recently, I talked with a friend. I was like, I had him on Skype, and I had one of this crazy pelt of a mustache that I have, like half of it was pressed down, and they're like, why why is half of your mustache one way? And I'm like, oh, I have bedhead on my mustache. So I guess I sleep on my face. I guess that's not normal to sleep.
You
like
have like a real mustache when you have bed mustache.
I have bed mustache. So what? And when you said tongue on the palate, that's how you're supposed to sleep. Your tongue's like literally. Are you talking your tongue's supposed to go to like the roof of your mouth, and your mouth is supposed to be closed, and that's
correct.
how you sleep?
You could literally tape your mouth shut if you wanted to try it. So
Okay.
you can tape your mouth shut, and this is like a thing that some people do. So it's not like that weird, but you're really supposed to breathe through your nose.
That's.
All the time. But I mean, Claire can speak to this too, right?
Yeah.
Well,
I totally can.
can I also just before you speak to it, can I also say just because it might give you a fuller picture. I also always brag to people about what a good sleeper I am, because it's really hard to wake me up, and I can like fall asleep. I can nap no problem. I can fall asleep very easily. There's been a lot of periods in my life that I just attributed to depression where I slept for long periods, but I considered myself a really good sleeper. But I do the thing where I jolt myself awake. Is that not a normal thing that people do? Is like jolt themselves, like sort of like gasping for air once in a while?
Yeah.
I don't think you're supposed to be gasping for air. I mean, again, it's like not our area of expertise. You really should get a sleep study.
Well, I'm talking to you right now, and I don't have enough focus to schedule an appointment and actually make the meeting. So anyway, Claire, tell us about sleep.
Claire can talk about
mouth breathing. Are you mouth breathing? Just that I did mouth breathe. Is that like what you're talking about?
Yeah, just what you're saying about how much different it is to breathe through your nose.
Yeah, okay. So I knew that I had a hard time breathing through my nose, but I just never really did anything about it because, I didn't think it was like that big of a deal. And then we did the mouth breathing episode, which coincided with me learning that like sometimes if you have like bone spurs in your nose, that can, contribute to migraines. Like, I'm not speaking as an authority. I heard that like from a doctor who knew. And migraines.
Bone spurs in your nose?
Yeah. That's
terrible.
What is it with? I started this like podcast because I was just like, I want to hear about why animals have sex in weird ways, and like,
now you're here.
Ever since the quarantine, it's like every episode is just like more bad news. Like me just finding out about some other horrible thing to imagine. There's bone spurs in noses that lead to mine.
Yeah, there wasn't mine. I mean, and I didn't even know that. So essentially, I went and I got my nose checked out, and I had to have surgery. So I have a new nose. And
yeah, I have a new nose as well
because I got bone spurs.
No, the bone spurs.
Wait, what is a? I'm sorry. This is. First off, I do love that it's going to be 3 ADHD people just yelling over one another. That's what I hope will happen. And first off, what's a bone spur? I'm just gonna just be vulnerable and let people know that I don't fully know what a bone spur is, and I didn't realize you could have one in your nose.
I don't know either. I had them in my.
I didn't know that. I thought your nose was made of cartilage.
Yeah, they didn't know about that.
Like totally confused.
I don't know. They didn't know about it until they did the surgery. But the reason I got my nose fixed was because of the breathing. So I could not breathe through my nose, and I didn't realize how bad it was until they like did something where they moved the thing that was not working. And then
is this one of those things where the mechanic goes and does the thing they're supposed to do, and then afterwards they're like, well, I was in there. I also fixed up this and that thing that they definitely didn't do for you, so that you write them like a good review? Or as what I'm wondering is if
Claire's
you got
nose
lied
was, like,
to
really
about.
effed up.
Yeah, it was really effed up.
Well, I know that's you got the surgery, but I wonder if they just kind of threw in the bone spur.
No, I really trust the surgeon. He was a good guy. I really think that that was just like Surprise! There's a bone spur.
Not this guy. He wouldn't make up.
What's that?
I'm sorry. I'm making dumb nose spur jokes. They are definitely not worth it. Okay. Continue.
No, I mean, I don't think it was like that at all. I think the surgeon was really good. And I think that was just like, hey, bonus, you also had a bone spur we didn't know about. So we took care of that too. And maybe that'll help your migraines. And so, yeah, but I can breathe way better. Way better.
What about migraines?
Yeah, I still get them.
It's just that now my nose hurts too.
Better. So I took care of that. So check.
Okay. Something.
I mean, like we said, Shane, is that there's never just one thing. It's all related. So that's like one piece of the puzzle.
I mean, if I find out that I've been just sleeping wrong the whole time,
you should listen to our mouth breathing episode and then get back to us.
I'm going to. I
could send you a diagram also, if that would help.
I'm always up for diagrams. That's in my bio. Always up for diagrams. So there's a couple things that I have. I don't know how to say. I go back and forth with how seriously I take the diagnosis of ADHD, even though I have it myself. I just am like dripping money. You know how people like subscribe to a thing and then they forget that they didn't that they subscribed to it, and then they've been paying like $10 a month like forever or whatever. I'm just doing that all of the time. Like I'm just always just leaking money that I don't know about, like everywhere, money that I don't have to be leaking, and just stuff like that. Like if I showed you my room right now, it's absolutely ridiculous. My entire and I have it. Anyone that knows me would say that I have ADHD. However,
I get the vibe. Let me put that out there. I definitely get the ADHD.
Thanks.
Yeah. So I think you're on the right track.
I'm not crazy. At least I'm not crazy. I've also been diagnosed as bipolar, so I guess I'm a bit crazy.
That one, but maybe not. It could be the emotional dysregulation.
Yeah, this is very poignant, actually, Shane. Great point.
I'm not saying you aren't, because I really am not qualified to say that because I am not treating you, but I would just say maybe revisit it. That's all I'm saying. Maybe
once in a while, I think I'm like a time traveler, so that's a little beyond emotional regulation stuff. Just once in a while, I start time traveling. That's pretty. I'm told that's mania, and then it goes away with medication.
There's more to mania than that, but yes, you should be part of it. But you would need more. You would need more than that for mania. I don't have my DSM-5 with me. I left it at home thinking I wouldn't need it. So
Sarah does usually keep it in her back pocket.
But can I speak to your thing about your question or your comment about ADHD? Is it a thing, right? Is it an actual construct that exists?
This is why I bring this up. I think that when I was in school, I was always in trouble. I was always in detention or whatever, but I was always, in my mind, I was focused. I was focused on imagining my future career as a comedian. I didn't think that school was going to help me in any way. So I was very focused on creating jokes and planning out my life and everything. So there's an internal focus, and then there's an external focus. I'm not the best listener in the entire world, but I can focus and write for hours.
Oh, Claire, you should talk about that hyper focus.
I'm raising my hand because I have some things.
We can't see you.
Oh, that's right. Okay.
Okay, Claire.
We're not ignoring you, but go on.
Okay. So, to speak to the, you were focused on being a comedian. So I think a better way of thinking about ADHD, instead of it being you can't pay attention, right? You can't attend to tasks. is more about like, again, I'm going to go back to regulating attention. So there are kids, like when I do a clinical interview with people, a lot of times parents will say, I know he can focus because I've seen him play Legos for like 5 hours and he's like making this amazing like Lego construction. Or, well, they can play video games for like 8 hours at a time, which video games like automatically don't count for a lot of reasons, but I won't get into that. So I would say that's hyper focus, but that's about regulating attention. So there's, being able to focus your attention and get started on something. And then there's the ability to sustain attention, right? And like keep focused on something. But I also think there's this piece of regulating, right? Like being able to switch what you're doing for like what the rest of the class is doing. And then therefore stay focused on it. And everybody daydreams a little bit, but we're talking about, but this gets to the point of clinical significance, or it gets to the point of like functional impairment.
Dysfunction.
Yeah, dysfunction. Yeah. Ooh, can I say another thing about dysfunction? Because earlier you
Are you raising your hand?
Yeah. I'm well trained. Because I'm trying not to interrupt, because I do that. Never mind. So I wanted to speak to functional impairment because I wanted to back up when I was citing some of those studies where we were talking about like stimulants being effective. Really what they're looking at though is symptom reduction. And so there's actually some discussion about, well, are these studies looking at functional impairment enough? So for example, and I work with, a lot of adults who have ADHD. And so for me, when I'm thinking about function, I'm thinking about, are you showing up to work on time? Are you able to manage your emotions and your temper at work? Are you spending impulsively? Do you struggle with and therefore do you have financial problems? I don't know, can you pass a class in college? So these are where those symptoms impact life and what they really, how they manifest.
Well, I'm just curious where creativity, because I've done a number of stimulants in my life. I don't really care for stimulants, but I mean, I agree that they like say something like, and I've tried some Adderall and what is it?
Ritalin.
Concerta.
Modafinil. No. What's the new one? No, it's not modafinil.
Are you thinking of methylphenidate?
No.
Okay.
It doesn't matter. Take something like cocaine. Done cocaine at a part where everyone else is like, yeah, oh my god, and I'm always just like, oh, this is what normal people think and feel like.
I'm gonna go home and study.
Yeah, that's what it makes me feel like, not super energized, just actually a little bit calmer or focused. I would say, which I think that's potentially that's what a stimulant does with someone with ADHD typically, right?
Yeah.
Rather than it might stimulate the average person without ADHD and make them hyper, but for someone with ADHD, it makes them calmer.
So I have to be careful here because I didn't go to med school, so I'm a bit out of my depth. So I always feel a little uncomfortable talking about medication and how it works because that's not really something I know a lot about. I know enough to say hey, here are some questions you might want to ask when you go visit the doctor, or you go visit the psychiatrist, or here are some other things to consider, or maybe you should bring this thing up. But beyond that, I really have to be careful about not speaking beyond my expertise. I will say, but I can cite what studies say about, the effectiveness of medication. And I don't know what particular study it was that I was just reading actually, that. So not that medication isn't effective for adults, but it's more effective for kids than it is for adults. I think for adults, really some of that behavioral intervention and really and truly, it can be teaching a skill set. But I think sort of life hacks, quote unquote, can be more effective rather than a skill set for adults.
Well, I was hoping, I'm sitting here, I'm trying to pull up this particular question that I got because it summed up a lot of, I got a lot of similar questions like this.
Okay. Can I say something
people.
while you're
yeah.
looking at the question? is
Yeah.
I have just noticed in my practice with children too is if you're a parent or you're someone who is looking to, you find that you have some of these maybe ADHD symptoms and you want to get like tested, et cetera. One thing just to be aware of or to make sure that it's known if you have anxiety, I think that I have seen just personally from experience, children who have anxiety and then go on stimulants like Ritalin or Adderall, it has typically increased their anxiety. And again, this is not like me like citing my medical journal. This is me just citing what I have seen in clients. So the point being that if you find that you're more prone to anxiety or your child is more anxious, just make sure that you tell your doctor that, so you like cover everything. Because if you get onto a stimulant and you're more prone to anxiety, what I have seen is that the anxiety increases with that medication.
I mean, and it could be that it's like, some of the physiological symptoms change, right? Like if your heart rate is going and your brain's like, what's going on? And it's trying to interpret what's going on. And you have this bias towards anxiety and, things going wrong. And that's how you interpret it is, like almost like panic, like I need, like your brain is responding to this as though there's a threat. I don't know that for sure, but that's
and then there's maybe a feedback loop or something going on.
I'm speculating because I can't cite any evidence on that. I just
love a good speculation.
I'm working through it, and I'm like, I wonder if that's what it is. It's certainly not an evidence-based speculation, but it might be worth looking into or asking about.
I bring it up because I did get a number. I couldn't find the one that I was looking for because, like I said, I just got tons and tons of questions from people. But just to summarize, there was a person saying something about how they were, they have had ADHD their whole life, and they've been on whatever medication for like 15 years or so, and although it's helped with their ADHD, they feel like it's made I forget if they said made them depressed or some they felt that it had negatively impacted their life being on a medication for 15 years. They have their own kid with ADHD and they want to find other tools to use this. I myself skeptical of, as someone who's hoping and praying and rooting for a vaccine now as fast as possible, and absolutely believe in things like that understand the mechanisms of infectious disease and antibiotics and that sort of thing. I think that a daily medication that is altering brain chemistry is something that does make me a little bit skittish, and I am a little bit skeptical of antidepressants and ADHD medication. So, one, what do you say to people that are maybe skeptical like I am? And two, maybe Claire, you'd be the best one to talk to about this. What kind of alternative kind of behavioral cognitive therapies, that's what you said?
Yeah, cognitive behavioral therapy.
Cognitive behavioral therapy. Would you recommend as alternative at least to try before taking the step to medication?
Yeah, so I mean, the first thing I would say is all the things that Natalie said earlier, like just making sure the foundation is set. I think that's really important. But
like those foundational level things are so important. Like if you want more of a holistic approach and then see like where that takes you and then kind of address that later, like you said, Shane, I think that's always really good.
But then do that first, right? And then if a person feels uncomfortable about the medication, I mean, I get that. And there are some kids, especially kids with trauma histories, where because you can have ADHD and trauma, you can have both, right? But medicating that can be tricky. So making sure you have like the right psychiatrist, not like I wouldn't say like a pediatrician, I would say a psychiatrist for things like that. But so like that's just the thing I'm putting out there. But if a person felt uncomfortable with it, I mean, so there's something called neurofeedback, I've heard people who I really respect say like, oh, there's no evidence to support neurofeedback. But yeah, I read a meta-analysis that was saying like, yes, neurofeedback works for ADHD. So I don't know why people say that, because like there's like peer-reviewed articles supporting neurofeedback. And I've seen.
Do you think that it's maybe not sorry for cutting you off. Do you think that it's maybe connected to just like that there's so much excitement? I mean, it seems like lots of people are talking about neurofeedback right now. And then there's also seemingly some charlatans just kind of setting up shop as like, hey, I do neurofeedback here. And do you think that's maybe some of the pushback that's coming from like classic academia about that? Because to me it does seem really promising.
So going back to it, it's not new. It came out excuse me. So Bessel van der Kolk in The Body Keeps the Score actually talks about it as a promising practice for trauma as well. And he talks about how, neurofeedback was coming about right around the same time that Prozac became popular. So it kind of got left to people weren't paying attention to it as much, but it's been around for a long time. I think maybe now people are revisiting it.
I think also like a lot of people just go to get neurofeedback and maybe without like a specific diagnosis or like necessarily a specific goal that it really can help with. And so that then what happens in that piece, like with a lot of things, is that the scientific evidence kind of gets lost. I don't know. What do you think about that, Claire?
Well, so my son has had it. So I've been through the whole like neurofeedback thing as a parent, having my son my son has ADHD. He's adopted, but we landed together. So it's like a house of ADHD. And so I took him for neurofeedback, and they do brain mapping. I can't remember what they use. Is it acute EEG? I can't remember, but they're looking at essentially, I'm going to butcher this because this is not my area of expertise. They're looking at the ratio of certain kinds of brain waves in different parts of the brain. And also I think there's in the prefrontal cortex, there's is it slower delta waves? I shouldn't even say that out loud because I'm probably wrong, but they're
I have no idea.
Yeah, they're looking at all of that. They're looking at it holistically, right? In different parts of the brains, what are the ratio of different kinds of brain waves? And I am sure that it is way more than that. So Google it. But essentially then they're just targeting that with the feedback, right? I will also say that not all neurofeedback practitioners are the same. I took my son to a really good one who are tested. I have also met someone once and I was like, seriously? They called themselves a neurotherapist. And I felt like,
there's a lot of terms that can also be thrown around in any profession.
Right. It's
well, this is because we're also talking about chiropractors too here, which is another one of those professions where it's just there's a lot of snake oil that can be in terms of there's a
lot of different quality of providers.
There a lot of quality providers, a lot of vague ideas of who gets licensing, and as far as I know, just anyone can provide neurofeedback to anyone can just make an app and be like, hey, this is a neurofeedback app or whatever, and then here, okay, I did this neurofeedback thing today.
I don't think that's true. I think there's lots of people who do brain training apps. Right?
Oh, I think it's true.
But I think neurofeedback, I've actually looked into getting neurofeedback certified and getting trained in it. It is you really do have to take courses and you really do have to understand it. But, there's lots of people who can pass the test, and it doesn't mean that they're right. You can pass the test and get the answers right, but functionally, how are you doing? Right. And so I think that I agree that I think that the quality of care is probably part of the hang up with people.
Also being able to determine does this person need this? Would this be beneficial and not? Because I think part of being able to do neurofeedback effectively is to be able to think about kind of what you're doing. So you need to have that awareness to do that. So if you're completely dysregulated and you're unable to attend to anything, then I don't think it would be necessarily that effective.
I agree with that because so it was pretty frustrating for my son when he hated it, honestly.
Right, because like he can't attend, so they're like,
there's a lot of like, there are glitches sometimes with the software, because we rented it wasn't an iPad, it was a tablet that had like the neurofeedback programs on it, but they were getting at the clinic getting feedback about how things looked. And I would say if you have poor frustration tolerance, neurofeedback would be hard, because remember, there's that goal-directed persistence, right? And so you have to persevere through something that's difficult. And if you're not really there yet, then that might make accessing the neurofeedback hard to do.
Honestly, you have to be regulated for neurofeedback, I think, to have like kind of an effect. Can I say something though? Can I?
No.
I'm going to raise my hand.
Absolutely not.
But I'm raising my hand.
Absolutely not.
I actually don't really care. I'm going to say it anyways.
Okay.
So I think that also going back to that foundational level approach, if you, so this is what I recommend for clients too, who, are presenting with any sort of dysregulation. So that could be more of, being unable to attend to any specific task for any period of time and kind of being like all over the place. And also on the other spectrum, having more anxiety and being kind of like worried and afraid of their environment. That I think goes back to that brain processing issue. And so just taking, like specific symptoms and going right to medication. I'm not saying anybody does that, but I think you're going to be missing a big piece. So what I like to help with parents to kind of decide in my practice is, right, going back to that foundational level. And then also, and Claire and I do this a lot, having kids work on the sensory processing piece, because if their brain is not processing information correctly, and that could be because they don't have the neurochemicals available. It could also be that the pathways aren't carved to be efficient yet, but you need to have some of that in order for the carryover to go beyond medication as well. So if you're just looking for kind of like an easy fix, or I think medication can be really helpful to take for a certain period of time to kind of get over a hump, or if something's like, really impacting you in terms of dysfunction. However, I think long-term, really focusing on, the sensory processing piece, and that's where, occupational therapy can come in, is can really change like how your brain is processing. And that can make more of like a longer term impact, I think, in terms of independence.
That's a really good point. And like, as I'm reflecting,
thank you, Claire.
How come I never get any pats on the back around here?
I'm gonna air five,
it's
Claire.
Just,
Sorry,
it's just you two ladies high fiving one another. All right, Claire. What do you?
I was gonna agree.
Show Natalie up now. I guess.
I'm not gonna show her up. I'm gonna agree with her, and I'm like reflecting on what you're saying, like in terms of like if you think big picture and long term. I was actually just reading this article about like the problems with how studies are designed when we're measuring the effectiveness of stimulant medication for people with ADHD, right? So like if, like I think, gosh, was it like 18? No, I think it was 48. No, that's too much. It was like a year and a half, I want to say. I'm going to guess it wasn't as long as you would think.
Did you just go between 18 months and 48 months and then come up with a year and a half?
I have the information. Can I grab it really quickly? I don't like giving people misinformation and kind of speculating and okay. So,
all right. Well, so we have nothing in common.
That was the funniest part of the podcast.
Well, as you're looking that up, and let me throw another thing in the mix here. I noticed when you said frustration, like I get that I get having frustration, really wanting to do a task and frustrated that you can't. I mean, I go back and forth with like, am I frustrated that I can't do my taxes, or is it just like no one likes doing their taxes, or, that sort of thing. And in school, I would say that I was very rarely ever like frustrated with homework, so much as I was just like, oh, I don't care about this. Like, I don't, like, if I was in like CCD or whatever, are you from, that's Catholic, Sundays, I'm like, oh, the reason why I'm not listening to this has nothing to do with my ADHD and more to do with there's nothing worth listening to here. And so I would say that, I can read like fairly dense-ish, like pop science books. I might struggle with more jargony papers or something like that. And I would say that I'm a slow reader, but I have like a really good, I grasp the concepts very well. I might not have the best retention for detail. But it seems like the reason I bring all this up is it because it seems like we live in almost an outdated, at least the education that I had seems a little bit outdated for where humans were. It seemed like a lot of like, can you learn to do just like, can you learn to memorize like trivial things? Can you learn to like, it seems like it was something that was built for like doing factory work, or something to train you to like, can you sit still at a desk and have a high threshold for boredom and trivial tasks? Because that's what you're going to need in life in your 9-to-5 job. And to me, like, I'll take my creativity over a lot of people's that are, you know, functional or very productive people. And so I mean, I think this is a question that a lot of people have, where it's like, we live in this world where hardly anyone stays at the same job for more than 5 years, just because the world's changing so fast. A pandemic's happening now. It's making us realize just how flexible we need to be. We're going to probably have self-driving cars sometime soon, where a quarter of the economy is involved in transportation. We're going to need to figure out what to do with that. What do you do when all the robots are flipping burgers for the fast food? It just seems like the kind of, this is coming from someone that did a lot of factory work before comedy. It seems like that there's going to be a lot more demand for people that can problem solve and divergent thinking and creativity and flexibility in our quickly changing world. And this, in the system that we're in, was just like this little, built in this little hiccup of time where factories were an important, like being able to crank out a widget was an important thing to do, which it no longer is because everything's automated. Questions, concerns. That's been the show, everybody. Thank you very much. All right. By the way, do you guys have like a while to hang out? I'm enjoying this conversation.
I do.
Can we? Yeah, it's like my bedtime, but I will stay up because
you'll stay up
for
a while, because we haven't even gotten to like autism or anything yet. It's like
we haven't gotten to what I think Claire has some really good points on just the school system with children with different needs and how that's impacting them, and also like families and parents as well. And I think that's important to talk about as well.
Yeah. So much I want to get to.
I have some stuff to say. So,
all right.
The first thing,
if you're raising your hand, we'll let you speak. Claire.
I was raising my hand for a while, actually. You can see me. So what I wanted to say was, going back to what I was saying about the studies, it was 6 to 8 months, and like 14 months was the longest study. Going back to the ADHD, the long effectiveness of studies. That was Molina and Swanson. I don't have the journal, nor do I have the year. But anyway, so there's not a lot of like true longitudinal data. It doesn't seem like there's a lot of true longitudinal data. Now, going back to what you were saying though, about schools, like I would say that was how school was when we were growing up. School's quite a bit now, like a lot more. Terrible. There's a lot more movement and flexibility, and you have like maker spaces, and
there's a lot more research too, linking movement to basically like neurochemicals that were released and how that therefore enhances learning.
Good.
And yet
because school was a prison that I was trapped in for a long time, and I thought it was kind of criminal, and still do.
But I was going to say, and yet ADHD persists, right? Like, despite all of the different like kind of innovations we have.
That's interesting.
We still have ADHD. And in fact, this was like a question that you asked a long time ago, but I remember it. And so it was about, how do we know that it actually exists? Well, I mean, we do neuroimaging. So, I mean, we know that ADHD is tied to particular parts of the brain, right? So, like the prefrontal.
And it's actually not an overactivity. It's a lack of a connection, correct?
I believe it's understimulated, right? I've heard.
Yeah, understimulated.
But so if you're looking at the neurochemical level, so we're talking about like dopamine and norepinephrine. Those are like the neurotransmitters that are involved with ADHD. And in particular, we're talking about the prefrontal cortex. That's all I know. I've heard that it's dopamine transport. But beyond that, like, I'm not a neurobiologist, so I feel uncomfortable speaking to that. But I can say that, so in the 90s, when we started doing, brain imaging, we had like MRIs emerge and all these things, we were able to really understand some of these disorders that we were talking about in the DSM better and link them to particular parts of the brain. And in a sense, that's like the hard science behind it, right? And then we see the manifestation of what that looks like in people's behaviors. And that's all. That's all I have.
I have nothing to add.
Well,
nothing interesting anyway.
I'm just deciding where to go here because autism feels like such a big conversation, but I got to get to school stuff too. And I really want to talk to you guys about remote learning and especially as it relates to non-neurotypical children and how people are attempting to figure out how to accommodate education for that. So I don't know, where do you guys choose your own adventure? Where do you guys want to go? I think we have tons we could cover.
Do you want me to go first, Claire?
I do. I was actually just going to say that. It's like,
yeah, okay. Yeah, I can feel that. So I think that there's a lot of children who are in school and just a lot of children growing up who have all different kinds of diagnosis and even not diagnoses that impact their ability to function in school as effective as possible. And so what that means is that you have children who really do qualify. They have diagnosis and they do qualify for an IEP, which is an individualized education plan. So they have specific services that are given to them at school. And then you have children who are on something called the 504 plan, which is basically like, if I have trouble attending, I might be able to get qualified or apply for a 504 plan. And that means that I have adaptations in the classroom to help me, learn as best as I can. So you have all of these children who have difficulty with maybe regulation. So they have trouble like attending, or they have more anxiety. And so how that impacts them on a daily life is pretty significant. And even if I'm a really dysregulated child, so let's say I come in and my dysregulation appears as more like the symptoms might be more of like anxiety. So I have trouble being flexible. I need to stick to a certain routine. I don't like things that are new. I like things that are very familiar. So then I'm stuck in my house and I haven't had a specific diagnosis. So I haven't really gotten any help yet. And my parents know that I'm anxious, but they may not even have really recognized it. And now I'm at home and that's very new. And I don't have the structure that's given to me that school provides, that predictability perhaps. And maybe there are some better things about it, but there's also going to be some more challenges. And then you have this parent who's also trying to work, most likely from home, and deal with their child who is more anxiety prone, and trying to keep this predictable schedule for them and give them what they need in terms of regulation. Because when you have a dysregulated child, you're going to have most likely meltdowns throughout the day, or at least one meltdown throughout the day. And that can be, anywhere from 10 minutes to hours. Mm-hmm. And then what do you do with that child as a parent if you haven't been prepared necessarily to deal with it? You don't have a specific diagnosis, but now you just have this really dysregulated kid at home, and you're supposed to maintain your responsibilities and then also and it might be even more apparent to you now that your child has some sort of maybe processing issue, and this is where processing disorders come into play, that you didn't really recognize before. Because oftentimes kids can even hold it together at school, meaning they can stay regulated at school. But as soon as they come home from school, they kind of lose it. So they can basically stay regulated for a certain period of time if they really, really try hard, and they kind of overpower the regulation with the top part of the brain, which I'm totally spacing on, but it starts with a C.
Are you talking about the cortex?
Yeah, the cortex. But
even I knew that one, Natalie.
Oh, Mr. Smarty Pants, come on. I was actually going to say cerebral 𝕊𝐵𝑔𝐬. So anyways, they think, and then they can't stay regulated anymore, and they just lose it. So you're going to have parents at home with kids who are just dysregulated all the time.
I mean, and I actually think some of the kids with 504s are going to be worse off than some of the kids with IEPs.
Can I ask how many kids do you both have?
I have two.
I have two.
How old are they? Yeah.
Mine are little.
I have a 13-year-old and an 8-year-old, and they both have individualized education plans. No, sorry, he's not 8. I said that 13 and 10.
Okay.
Yeah.
So what do they do? What do they do? How has this changed during the pandemic? This sounds like every time I talk to a parent, I mean, this seems like such a nightmare. And then also the idea of opening up schools seems like an absolute nightmare as well. This is seemingly one of the most challenging. I don't have kids myself, and I cannot even imagine the challenges people are facing, but I can certainly understand why people are frustrated.
Yeah, I mean, I have two kids. They both have individualized education plans. My oldest son has ADHD and learning disabilities, and beyond that, he does fine. He really I believe that he's probably in the high average intelligence range, but he just can't learn in the same way that other kids can. So ADHD also, writing and reading disorders are really, we say comorbid, meaning they co-occur with ADHD a lot. So none of that's really surprising. He used to have a really hard time with his ADHD, honestly, before we got him on the right meds, and truly neurofeedback was life-changing. I did not expect it to be as impactful as it was. So he's doing okay. He's pretty self-directed. And I think, there were some kids in his grade level that were, 7th grade boys that weren't always kind. And so, having some space from some of that toxic behavior, I think was kind of good for him. For my youngest, it was tough. So my youngest has more significant disabilities. And we actually talked about him in there's a case study episode we did on our podcast. And he had a really hard time because I think he has a really hard time. His expressive language is, he's 10. It's probably more like a 4 or 5-year-old's. And his receptive language, meaning what he can understand, is also pretty poor. And I suspect some auditory processing issues. And so his ability to learn is really impacted when he's online because he looks at what other kids are doing in class to figure out what to do. And I think there's a lot of kids that do that. Like when they have a hard time processing all the information coming out, like Natalie was talking about earlier, especially when they're in a general education classroom, right, with all their typically developing peers. They a lot of times can't figure out how to ask for help. They can't formulate the sentences, and maybe anxiety gets in the way a little bit too. But they're also maybe having a hard time processing everything that's being said. So a lot of those kids look to what other kids are doing to figure out what to do. And so when you're at home, you can't do that, right? So what's happened a lot is here's an assignment, here's an assignment, here's an assignment. And I want to be really clear. I'm not speaking negatively about his experience with school and his teachers. They were amazing. Everybody did the best they could in those circumstances. But I would say if it continues to be something where you just post an assignment and it's hey, get that done. Even if you read instructions, he's self-directed, but he's not going to be able to understand all the directions that are being spoken to him, and he can't watch what somebody else is doing to figure out what to do. And then there's like this intense feeling of failure, right? And you internalize that, and you feel like, I mean, kids say they feel like they're stupid. And I think that happens with him.
I mean, when you say that, I've made this point. Granted, as we've pointed out, education was a lot different when I went through it, and I'm probably unnecessarily bitter about my experience. But my take on the situation, when I hear about some of like the homework assignments and stuff going out, I'm like, why? Why is there like this is an incredible learning experience about like real life situations for everyone involved, for teachers, for parents, for kids, to still be like hung up on trying to get out like what seem like questionable like standardized testing. I'm talking about for just like regular kids in the general population. It just seems like a little bit odd to still have like that's what we're worried about, kids still getting certain homework. Like, get your American history lesson. Like we can't go 3 months without hearing about Benjamin Franklin as like the greatest history like your kid's ever going to live through is happening around them. Like, hey, don't pay attention to any of the stuff that's going around you. We're gonna, that Benjamin Franklin put a key on a kite, which he actually didn't do, but we're gonna teach you that for whatever reason anyway. Like, do we absolutely need the homework right now? Or can we just can we ease up a little bit on the homework and testing and put a lot of emphasis into being like, hey, how do we figure out how to like socially distance and let kids like relate to one another through Zoom or remote things, and maybe learn more about washing our hands and give some lessons about why masks are important and things like that right now. I don't know. I don't know. I don't know why we're still doing homework.
Okay. I totally have a lot of stuff to say about this.
Okay.
I don't really have anything other than I agree, but I'm kind of curious as to why Claire has so many things to say.
Yeah. So I can't speak to learning about Benjamin Franklin, because that sounds like an upper grade. Like, I can speak more to elementary level. I mean, I think part of the reason is, so for kids with disabilities, there are truly kids when there's they need learning over the summer, even, because if they're not getting that repetition, and these aren't things like Benjamin Franklin, right? This is like reading, and this is like math,
like foundational skills
to allow them to function in the world, right? And to not be taken advantage of. And so for some of those kids, they really need that. And so, I mean, I do see the importance of it for that reason. And I also wanted to speak to like the purpose of schools and what kids get out of schools is beyond academic, right? So kids go to school and they're around all these other kids and they make mistakes. They're learning how to regulate their emotions. They're learning how to solve social problems, and then they're failing at it, and then they're figuring out what to do better next time. And so there's like, the brain is an experience dependent organ. And so, they are developing in the context of all these opportunities for socialization. Now we don't have that, right? And then the other thing I wanted to say was just about, so this is not, for kids who are, neurodiverse, right? Like the kids with disabilities. This is general population. So we have, there was an ACEs study done, back in the 90s with CDC and Kaiser Permanente. And essentially they looked at adverse childhood experiences. So they looked at, these experiences were like experiencing violent abuse or neglect, witnessing violence in the home or community, incarceration, parental separation, substance abuse in the house, mental health problems of a caregiver. And I don't think that means like mild depression or a little anxiety. I think there's like significant mental health problems. And they found that the more of these you had, the more impact on your health. So like, for example, they found 61% of people had one or more event, right? But 1 in 6 had experienced 4 or more of those things that I just said 1 in 6 people. And there were 17,000 people who participated in this. And they found that the more these experiences you had, the more impact on your physical and mental health. So, for example, people who had 4 or more of these had a 700% increase in alcoholism, or like 700% more likely, right, to have alcoholism is something that they were experiencing. Double the risk of cancer, 4 times the risk for emphysema. And then I don't remember what the depression was, but they were obviously much higher rates of depression. And then just overall, what they were finding is that these experiences, contributed to high-risk behaviors, obesity, heart disease, like I said, cancer, chronic lung disease, shortened lifespan. So there's actually like a physical impact when people have these life experiences. And we know now that 1 in 4 before COVID, 1 in 4 of kids living in the United States were experiencing, I don't remember if it was 1 or more, but we have a lot of kids who experience these events. And so school is a buffer. So school is more than just academics. School is like a safe place where kids who, there was food distribution. That's great. But if your parent is like, totally passed out from drinking all night, and you can't go get the food, you still don't have the food. Right. And so, and school has mandatory reporters. So these are like a safety net of people who are looking out for kids who are experiencing violence in the home. So there's this big safety net for kids who are really at risk. And there's a lot of kids in our country who are at risk for these experiences. And that was before COVID. And we know that, obviously stress is increased in the house, in the households and homes. And when parental stress increases, people are more likely to, they're more likely to physically discipline or more harshly, right? So now we have all this other risk. So there are some really good reasons beyond just academics in terms of social emotional development, in terms of a safety net for why this is important. And then we get to kids with disabilities. Kids with disabilities have an even higher rate of abuse that they experience. So that's why this is really important. So the World Health Organization says kids with disabilities are 3.7 times more likely than non-disabled peers to be victims of any sort of violence, 2.9% times more likely to be victims of sexual violence. And then if you are talking about specifically people with intellectual disabilities, which is what we used to say mental retardation, now we say intellectual disabilities, they're 4.6 times more likely to be victims of sexual violence. And these are kids. So these kids with disabilities have this double whammy, right, with schools being closed. So I just want to put that out there, that there are a lot of, I'm not saying we should open the schools. I'm not saying that at all. But I'm saying when people are talking about the importance of being in school, that's why they're talking about it.
Oh, yeah. I mean, this is the challenge of our lifetime. I would gently push back to some of the amount of social interaction. My memory of I was always told that kids needed to develop social skills, and that's what schools is so important. But I remember having to sit in a desk and listen to one adult talk at me the whole time. And if I tried to talk to kids, I got disciplined for it. So I was like, oh, where's the social skills? Oh, it's between class when I get a wedgie in the bathroom. Right. Terrific.
You sound like a popular kid.
I think that I just enjoy hanging out with the neighbor kid. But during summer, I had a lovely social experience with kids and whatnot. Of course, domestic abuse is going to go up in all of this is going to be one of the most challenging periods of our lifetimes. And I think we're talking about as we're talking about reassessing priorities, I think that this becomes a little bit of, when you say there's more than just the education, I think that's the important part of this conversation. If we all just admit that a lot of what this is about childcare, about parents needing to work, about kids needing to be fed that don't have the resources. And so then you're talking about housing children during a pandemic at least as much as you are about education. All of that I'm saying is that I think that you need to separate those things a little bit, figure out what you're trying to do first, which is like if you're trying to collect and feed kids in a safe, distanced way in a building, then probably the school lessons get knocked down a little bit, and the people that do get the lessons are probably the kids that need a little more attention first. In a world where we only have so many resources and we're facing an incredible challenge, it seems like we're going to have to just have like a little more, a very interesting conversation about what this means going forward, and how we could possibly open things up and have childcare and everything else.
Well, or I mean, and one possibility, and I really think
Natalie, nothing. Natalie, you've been so quiet.
Anything to add?
I have nothing to add. No, my kids are young. They're 1 and 3. So, in terms of my experience with like schooling has been sort of not as much. And my experience has almost been kind of like very similar. Like I was taking care of my kids and now I'm still taking care of my kids. I mean, regardless, I agree with like kind of all of the points that are being brought up, for whatever that's worth. Probably not much, but
I mean, that's all that I really want to hear.
Do you want a little praise? Like, good job. Like a little dude air 5. There you go.
Yeah, I just did really poorly in school, and so I started this podcast to have smart people tell me that I'm a good boy and I'm actually smart and worth it. Claire, what were you going to say?
I was going to say that I think we have to, I want to be really clear that I'm not saying that we should open up schools. And I also have to be very clear, because I work in a school, that I'm not speaking for my school district. I get that, we're in a pandemic, right? Like, we have to treat this with caution, and we have to make sure that we're looking at what the data says, especially from our local health organizations, and that we trust the people who are giving us that information. So, I mean, and that varies. Obviously, within a state, it varies across the country. But I think that connection then is something that we have to think about. How do we have connections with kids? And so maybe when we're talking about school this year, online, not online, whatever, in-person, hybrid model, that we're really focusing on connections with our kids, because they've been through something that is not something that most of us experience in a lifetime. And a lot of them probably have not been able to process it. There's probably been a lot of people who are like, let's not talk about COVID, so we need to rethink connections. We need to rethink about how do we process these emotions and make sense of what's happening. And guess what? When you do that, that's integration. That's like horizontal integration between the right hemisphere and the left hemisphere. And that is improving child development, right? Like, that is development, that is growth. So that's just another way of having growth and encouraging development. And so we have that, even if we don't have learning in the way that we are used to. Sorry, Natalie, I saw you raise your hand.
The point that I would make about all of that is that I think that this is like, it might not be the learning that we're used to, but I think that this is one of the greatest learning opportunities for everyone that we'll ever have. So I'm not that worried about people getting like an education other than the kids that have extra needs. Natalie?
Yeah, I was basically, Claire kept talking, and then she was going to kind of say what I was going to say. But I do think that also, like, in terms of parents being able to analyze how they spend their time too, I think this is more of like a different kind of conversation, but and how they're interacting with their children and what needs they can provide their children, whether regardless of if they have different needs or not, is a topic that is becoming more pertinent, I think, to this time too. And also, just if you have a child, like going back to that scenario where you have a child who's dysregulated at home and you really weren't aware, or you were kind of perhaps like even undermining, not on purpose, but undermining like sort of like the quote unquote behaviors that you see, and now you really see them, I think that can also be beneficial, because it kind of wakes some parents up to, gosh, how can I provide better for my child's needs? And I'm not saying like, parents are going to say, well, I'm working all the time, I don't have the time for that. And that's not necessarily what I'm suggesting. And I recognize that. However, I do think that you can be aware of something is like always the first step.
Yeah.
So.
Agreed.
Yeah.
I was just gonna say I agree.
Are you raising your hand? We can't see
No.
you. Just say I'm raising my hand.
I know I am.
So-
I'm agreeing, and I have nothing to add.
Well, you guys are awesome. I hope everyone checks out your podcast. I have one. I mean, I feel like I could talk for another hour, but let's put a little bow on this. What do you think that, do you have, say I gave you 5 minutes to give the most useful advice to anyone dealing with getting the most out of remote education and remote schooling, because I'm going to take a wild chance here and say that even if it isn't the entire country, a lot of people, even if it isn't the entire semester, there's going to be, through this semester, a lot of people listening right now that are going to have to be dealing with continued remote learning.
I think that, if I was just going to sum it up, I think that there's a couple points. One is just to have more awareness, perhaps, of what your child's need is, regardless of what that child's need actually is, but just determining even more of their learning style, so that when you go back to school, you're able to advocate for your child a bit better in terms of, their strengths and weaknesses for their teacher. And I think also just, circling that back also to the child, if the child is able to kind of think about their strengths and weaknesses, that can also be really great to have that child advocate for themselves, especially when you have a child with different needs. That ability to advocate is one of the skills that, eventually you want to be able to teach them, like, I need a break, I need this, I need that. So I think that is something that can be taught, at home with the parent. And that's a big thing. And I also just think that taking a peek at, those foundational things that we talked about as well is something that you can do, really without any additional education or time, just being able to analyze the sleep and nutrition piece. And is there something else that's going on, that I can improve upon, with myself or with my child, so that when we re-enter any sort of more formal education, that we're more prepared. And that goes along the lines with, too, making sure that your child is as healthy as possible. And then that also circles back to those foundational level skills.
Well, sounds like a good time to put stock in Fortnite is what I...
So you got my point?
Yeah.
I say Star Wars Battlefront.
Oh, yeah. Everyone's going to do all that. Done and done. I mean, this is what I asked for. I did ask for the, ideal advice. I think that my listeners will take a lot of this to heart. I wish I had more listeners, and I wish I had more people that were interested in this sort of stuff, because I worry the people that need to hear this kind of conversation the most probably aren't going to hear it. But regardless, Claire?
Yeah. Okay, good. Because I actually have some stuff I want to add. I think Natalie really covered a lot of the sort of becoming aware of your child and their learning style, and just the kind of basic foundational things that are important to everyday functioning and development. And I want to address, so the first thing I want to say is that, I can't give an answer about what's the best thing for online learning, because everybody learns so differently, right? We differentiate our instruction for kids with disabilities, and we differentiate for kids who don't have disabilities. So, it really just depends on the kid. And so then I would defer back to, or refer back to what Natalie is saying, defer to what she's saying. But what I would say is I agree. I think it's a huge opportunity. And so when I say that, what I mean is going back to what I was talking about earlier in terms of horizontal integration, right? So we have this, especially little kids are existing in this sort of, feeling the sensations of their emotions, and kind of this right brain sort of autobiographical, here are my feelings, but I don't have words for them. It's more big sensations, nonverbal stuff, reading nonverbal cues. And then we have left brain, right, which is more like logical, sequential, using language. And I'm oversimplifying things, but I'm doing it because I want to make it like, accessible. But part of development, like I was talking about in brain development, is integration. And so if kids are having a hard time with COVID, helping them to kind of start back at the beginning, right? So like, you might have to initiate it for them, because a lot of kids have trouble getting started on things, but you might say like, okay, so let's draw like we're going to do like a panel, and it's going to be like cartoons, right? Or stick figures, or we're just going to say this verbally, like what happened? So, March 13th, we all learned that you went home from school and you had no idea that you weren't going to see your friends the next day. You had no idea, right? And then you just found out you weren't going to see your friends, and you didn't know when you were going to see your friends. And how did you feel about that? And then, so like really integrating that logical sequential with the feeling, right? And what did that feel like in your body? Because that is integration. That is helping with brain development. And then having the kid kind of continue on from there about what that was like and what happened. I mean, that's like the big story, right? But it could be even for little things, but helping kids name their feelings, identify their feelings, notice their subjective feeling states. I mean, there are all these things that we can do to help with a different kind of growth than we normally talk about in the schools, that I think is really important and very foundational. And I'm getting a lot of this, like my ideas or the things I'm talking about, from a book called The Whole Brainchild. And I feel like every parent should read or listen to The Whole Brainchild. It's excellent. And it goes into detail about all of these kind of interventions, the kind of things I'm talking about.
I'll just point out too, Claire, though, to that point, if you have a child who is dysregulated, going through, like reading The Whole Brainchild and then trying to do like a top-down approach that you're talking about, you'll most likely not have that much success, because that child is most likely unable to access, the cortex. So that just being said, because if every parent goes home and tries that, I think it's a great book. I think it's really applicable in a lot of situations. However, if your child is dysregulated, that's not the place I would necessarily start. But if your child is regulated and able to attend and kind of take in what you're saying, definitely.
What about...
Oh, slam, Claire!
We do this all the time on podcasts, but
Oh, the gauntlet's been thrown down, Claire.
We do this all the time on our podcast. But I have a question for you, actually. So pushing back on that, what about the part where when we're talking about right brain communication? Because that's attunement. And I feel like anybody can do attunement, right? Like if...
Well, yes. However... if you're attuning to a child who is dysregulated, you can do it I would do it non-verbally.
Because that's right brain is the non-verbal piece. So I feel like anybody can do that part, right? And that helps.
That's just basically like you're trying to connect with your child, which I think is really important. And you're connecting with a child without more of like the cognitive piece, right. Without talking. So it's like thinking about what you would do essentially like with a baby.
I just think there's a lot of useful tips in there. And there might be some parents who are like, I don't know if my kid is dysregulated, so maybe try it, right? But just know that the right brain, that attunement, that is really important for everybody, right? And attunement is
that is important for everybody.
About is like facilitating attachment in infancy. So that should work for everyone.
Can we agree on body keeps a score?
Yeah.
Huh?
Totally.
Oh, that's a good one.
I don't really know what that means. Oh, is that a book?
Yeah.
It's real good. Well, let's all agree. I'm sure all of the listeners, parents out there, especially the ones with non-neurotypical, is what I say in the beginning, non-ordinary. Oof. I gotta start editing
already.
I gotta start editing on this podcast. I know. Well, I hope that everyone does tune into the podcast A Little Cerebral with these ladies. I mean, I feel like we covered pretty much everything that there is to know about kids in the podcast today, but I'm sure there's a few nuggets. Even, I mean, I did carry a lot of weight on this episode today, but I'm sure even without me, there might be a few useful nuggets on A Little Cerebral. Is there anything that you want to just anywhere they get podcasts, or do you guys have a website or? Instagram or anything else that you'd like me to direct people towards?
So we have a Gmail account, 𝐿ittleCerebral@gmail.com. And our podcast is A Little Cerebral. I think we're on all the major podcasting networks. So we should be, not networks, but stations, whatever you call it.
But if you have like a story, we love hearing parent stories, and then we can talk about it, which is really fun.
That is terrific, because like I said, I had 1,000 people with questions, and I just had to like clump a bunch of them into topics to discuss. So I think you're going to get tons and tons of emails from listeners. At least I hope that you do, because my listeners are fantastic, and I know that they'll enjoy your podcast as well. What was that?
I was going to say we have Instagram, kind of. It's we
have a technical Instagram account. I wouldn't bank all of your money on that right now.
Yeah, kind of. That's how I'm like, just with life, just broadly. Like, I'm kind of doing it, you know. It's like, I guess it's happening. Natalie Mannherz and Claire Duckwitz.
Yep.
Nailed it. Thank you both for joining me. You are fun. You're very intelligent, informed, and have lots of interesting things to say on such important topics. I wish I had both of you for another 2 hours. Maybe we'll do another one again.
That'd be great.
Sometimes soon. The next one will be how do you help teach American history to your non-neurotypical child well on Mad Max rolling Jeep with a Gatling gun attached to the top. But
getting sensory input. I mean, there is that, right?
Very educational experience. Well, all right, you guys are awesome, and thank you, listeners, for being such wonderful, curious people. We'll talk with you next episode. Bye. Hope you enjoyed the show, everybody. Make sure and subscribe, comment, follow-up questions, anything you got. If you want to support the show, become a Patreon saint. Head over to Patreon. If you're not into Patreon, you can go to the HereWeArePodcast.com website. You can Venmo, PayPal. I'll take money any way that you want to give it to me. One of my partners, Lost Sailor Design, who I've been working with, I've been selling merch for the Here We Are podcast for 5 years now. A bunch of different keychains. We got all sorts of the belts and things like that. Now, if you go to Lost Sailor Design, if you look in the description of the show, you can see a Lost Sailor Design. There's a look at this, a belt there with is that an ayahuasca root? Oh my goodness, what's that doing there? You can go and you can get an offer code for Here We Are 20. You'll get 20% off the entire store. So not only can you custom design handmade leather work that Jared at Lost Sailor Design will make custom for you to your liking. Maybe you don't want a tie-dyed keychain. You want some other color. He'll make it to your liking, and maybe you don't want some Here We Are stuff. You just want an awesome purse or journal or something amazing like that. I've got a bunch of them for gifts for friends and girls and stuff like that in the past. 20% off the entire store with the offer code Here We Are 20. You're also supporting this podcast and supporting your sense of fashion and style. So check that out. More info in the description below, as well as an audiobook deal. Thank you for watching.